My name's Harry Foster. I'm the President and CEO at Family Healthcare Network in the Central Valley of California. And we're very interested in attending the conference in Toronto. I forgot where it was. In Toronto. Because we can learn so many things from our Canadian friends. And we're hoping to learn from other nations too, who are far advanced to the United States in regards to having healthy communities and health homes, rather than just episodic health care.
What do you think you're most looking forward to learning about when you get to Toronto?
We really want to learn about where the bars are, the nice restaurants. You don't want that.
Yes, there's a lot of good ones.
We're not interested in that. What we're really interested in is learning how to get from where we're at right now and transforming into a health home. And in Canada, that's already been achieved with the universal healthcare system there. So we'd like to know some of the barriers and obstacles that we're going to have to overcome to accomplish that.
And what do you think Canadians can most learn from you, the American Community Health Center movement?
I think that we have some good quality measures and systems that would probably be helpful to the Canadian system.
My name is Carrie Hunt. I'm the Vice President of Human Resources and Training at Family Healthcare Network in Central California.
And are you looking forward to attending the conference in Toronto next June about community health centers?
I'm very much looking forward to attending the conference in Toronto next year. I think it's going to be a wonderful experience. The opportunity to sit in an arena with individuals that are very passionate about providing care across country lines, and hearing how all the different diverse approaches people have taken to making that happen.
Now, you're somebody who has to do a lot of managing of people within community health centers. What would you tell your fellow human resource colleagues who work in community health centers here? What would you tell them about what they might learn when they come to Canada?
I think it's going to be a great opportunity for us to talk about the effects of change in this very rapidly changing environment we're in, and how to help our employees to do that transition so we can effectively provide care.
Mark Weatherhorn, I'm the National Advocacy Director for the National Association of Community Health Centers. I'm looking forward to coming to Toronto, not only to find out about Canadian health centers, to talk to people up there about the issues and problems they have, but to also share some of my experience about how we advocate for health centers here in the United States, to see how those might translate into what you do in Canada.
And what do you do here in the United States?
In terms of advocacy, we train and activate a vast army of folks at health centers, patients, staff, and board members to understand the issues that the government acts on that affect their health centers, and how they can make sure the government works in a way that helps health centers and doesn't hurt them.
And that's had a big impact. I gather your efforts have had impact.
I think our advocacy has been critical to our ability to see the health center program grow, to take care of more patients, and to be prepared to be a major force in primary health care in the United States.
What if I said that the Toronto conference was an early effort to build a community health center movement around the world? How would that make you feel?
I think I'd be so excited that I really wouldn't know what to say. I think the idea of helping to build that movement beyond the United States and Canada, to help people empower patients and to provide health care to more people around the world through the community health center model, would be something I would be forever glad to have been involved in.
Okay, thank you. See you in Toronto.
Great, thank you.